So yes. But that was a different case. That was a broken heart. But I can't get into it because there are confidentiality things. But I'll give you an example of a broken heart. You come one day to the doctor's office and you say, I'm short of breath. You've never had a heart problem before in your life. And I listen to your heart and I hear a loud murmur. Whoosh, 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 whoosh. Your heart is not supposed to sound like that. It's supposed to sound like. But when I hear whoosh, 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 this is not normal. And so I ask, and this is loud, in a person that's never had a murmur before. So I say to the person, what is going on? Have you ever been told you have a murmur? No. So this is bad. Anyway, this person's heart disease, I sent that person to a cardiologist, and the cardiologist says, nothing I can do with this. I can't even do surgery on this. I can give medication, but that's about it. If you're short of breath because of your heart, that's a big problem. So I can't tell you the specifics, but I can tell you that this person died of a broken heart based upon the duration of this person's sentence. Right? That's about all I can tell you about that. All right, but they didn't have any heart problems. They died of a broken heart. So, be careful about your heart. I'll segue just a second, because there's something that's not in the medical literature that I was impressed to tell you today. I just read it as I was sitting here. Did anybody ever read in Ellen G. White's writings about vital force? Vital force. You don't see it in the medical literature. What does it say in Ellen G. White's writings about vital force? Because that's important, what we're talking about today. Do you remember?
I don't know if it's appropriate for me to mention. She mentions about self-pleasure. And she says too much of that kind of stuff takes away the vital force from an individual or something like that.
Yes. So what is vital force? You will not see it in the medical literature. I've never seen it. But it is a thing. And I saw it this week. So I will tell you. I read it first when I was in 6th grade because it was odd. It was just an odd thing. It said that Adam and Eve were endowed with about 20 times the amount of vital force that we have today. In Patriarchs and Prophets, it said Adam was 12 feet tall and Eve was 9 feet tall. Those kind of things amaze me. 12 feet tall? And Eve is 9 feet tall, reached his shoulder. That's amazing. And they had 20 times the amount of vital force that we have today. So I want to know, what is that vital force? Because I like superhero movies and things like that. So vital force, they had it. And you have it. And we have it. So vital force is your life force. You're given a certain amount of life energy. And you can use it quickly, or you can use it slowly and gradually. Guess what happens if you use it quickly? You die earlier. Guess what happens if you kind of ease up on it and coast along with your vital force? You preserve it. And guess what happens when you preserve your vital force? You live longer. So it's important to understand your vital force. Can you think of some things that will decrease your vital force? Decrease. Strip it away quicker. Stress. Any kind of stress. Anger. Stress of unforgiveness. Stress of too much work. It said it in Ellen G. White's writings. Even if you work too hard, that's a stress that will decrease your vital force. Not getting enough sleep also decreases your vital force. Getting too many illnesses, you have to recover from them, and you have to use what to recover from them? Vital force. So the more you are sick, the more you are having to combat those sugary things that you're eating, because it causes more than just what I talked to you about. It also causes inflammation. And then you got to battle that. And so then all these things decrease your vital force. So try to preserve your vital force, because then you also preserve your life and health. Because there are some people that live long, but they're unhealthy the whole time. You want to live long and healthy. Okay, back to the topic. Yes, sir. Yes, but I think your immune system is just one part of your vital force. Your immune system depends, in my mind, upon your vital force. If your immune system can go down because of lack of sleep. Your immune system can go down because you just decide you're not going to wear a mask during COVID and get COVID over and over again. And then you have to battle out of it, you know. So, yes, your immune system is something that depends upon your vital force. And if you have low vital force, guess what's going to happen to your immune system? It goes low. Okay, you're about to, yeah, I'll leave it at that. Okay, number 7. I'll try to end by 5:30. Okay. All adults should be assessed at every healthcare visit for tobacco. So if you still smoke tobacco, stop. Because tobacco, you know what tobacco does for your heart? You know, the funny thing, it's not that much different from what sugar does. It scuffs up and makes your blood thicker and rougher. So then the cholesterol in it is also thicker and rougher and easier to stick. Okay? So if you smoke, besides the fact that you have a high risk of getting lung cancer, you also have an increased risk of heart disease. So if you smoke, stop. Oh, there's a hand. Yes, ma'am.
Does all sugar have the same impact? So honey, maple syrup, these other alternatives to sugar, do they affect the body the same way that the processed sugar does?
That is an excellent question, and the answer is no. The sugar that you get from natural sources like fruits and vegetables and honey and maple syrup, this is fructose. When I'm talking about sugar, I'm not talking about that kind of sugar, because that sugar has not been shown to cause the problems that refined sugar causes. Yes. So fruits and vegetables, God put them there, put in a good sugar for you so you can have something tasty without the adverse effects of it. Excellent question. All right. Yes, sir.
As far as back as he can remember. And when we were working together, he had to go to the hospital on a couple of occasions. And at one point he said when he looked and saw what was coming out of him when they were flushing his system, he said he's not going to smoke again. Immediately he stopped. That's what he said. And within like a couple of months when he got back and got better, he came back and started the same thing over again. He did not make it around the second time. Yeah, because of the same thing that he just started to repeat the same thing over, and the same thing happened again, and he didn't make it out of it that time. So my advice to you, to anyone, the best way to stop smoking, don't put the cigarette in your mouth.
Okay. So he's right. There are receptors in your brain called nicotine receptors. And for someone who has never smoked, they stay closed your entire life because there's no nicotine coming across there, so they never open. But if you smoke, those nicotine receptors pop open, and they are very selfish. They want nicotine to be sitting in them. And the worst part about it is that those receptors are in your brain. So your brain is uncomfortable unless nicotine is sitting in those receptors. And so the craving to smoke is lifelong after that when they're open. So the best thing, as Brother Lewis said, is don't open those nicotine receptors. That's a Pandora's box you don't want to open because it will never close. Yes, let me give ma'am a chance and then I'll come to you, sir.
Second answer. What about the that? Yeah, like when you're around people who smoke, you don't smoke, but people around you in your job or Stuff like.
That's a good question.
To be honest with you, and you won't like my answer, secondhand smoke is worse than the person that's actually smoking. Why? The person that is smoking has a filter that's filtering all the carcinogens, cancer-causing products out. Not all, but a lot. But the smoke coming off the end has no filter. So you're getting the raw and unadulterated badness from that tobacco. So it's worse, actually. So you would be, better off just getting out of that situation altogether, if you can. Yes, sir. Same question.
Nicotine receptors, if secondhand smoking opens those nicotine receptors.
That I'm not sure about. But I'm not sure. I can't answer that. But what I can say is, I've not treated a patient that had, an addiction to nicotine that was receiving secondhand smoke. I've never seen that. Yes, miss.
What happens if you smoke and you open the if you smoke and you open one of your nicotines in your brain and you stop?
That nicotine receptor stays open and wants you to have nicotine every day, all the time, so that the nicotine will be sitting in the receptor.
But what happens if you don't do it?
Then you're always going to have the craving. So what you're going to have to do is battle that craving every single day. It's like being hungry, but you're not supposed to eat because eating is bad for you. You'll still feel it every single day of your life. You just have to fight it. So never start. Okay. Yes, sir.
Can you get lung cancer even if you never smoke?
Yes. You can get lung. Sorry, go ahead.
Yeah, the reason why I has one of my clients, he never smoked, but he died of lung cancer because he used to ride motorcycle all the time, so.
Yes. You can die of different lung cancers just depending on your occupation, okay? And about the places that you're around. For example, shipyard workers, they get small cell lung cancer, okay? People that work around asbestos, they also get mesothelioma. These are cancers that are caused by just being around certain things that cause cancer. So yes. And sometimes you get adenocarcinoma, which just comes up because you're human and you got unlucky. Okay. Let's go on. Aspirin. Yes and no. And I'll tell you the yes, and I'll tell you the no. So what does the American College of Cardiology say? Aspirin should be used infrequently. It means don't use it very often in routine primary prevention. Don't use it just because you're trying to prevent yourself from getting a heart attack. And we'll use the calculator, and I'll prove it to you. Sometimes taking an aspirin actually increases your risk. Sometimes it makes absolutely no difference, but increases your risk of dying of bleeding from too much aspirin. So the times that you should be on an aspirin are 3 situations. If I see one of these 3 situations, I'm going to ask you, please take a baby aspirin every day. Number 1, you've had a heart attack before. You need a baby aspirin every day. Number 2, you've had a stroke. You need a baby aspirin every day for the rest of your life. Number 3, you've had colon cancer. Then you need a baby aspirin every day. These are the 3 absolute reasons why you need a baby aspirin. But if you've had an ischemic stroke, that means you had blockage that caused the stroke. Sometimes you have hemorrhagic strokes where you bleed out. You don't want a baby aspirin that increases the risk of bleeding when you've had a hemorrhage. No, it's when you've had a stroke where you blocked a blood vessel. Okay? Yes?
A person with a stroke, night or day better to take an aspirin?
Baby aspirin works better at night. And I'm going to tell you why. And so does a statin. Why does a statin work better at night? Yes. Well, yes, almost. It's when the body metabolizes cholesterol. Means when you go to sleep at night, your body figures, okay, this person's not doing anything else. I'm going to let this cholesterol settle in the liver, settle in the fatty tissues, because you're not using it. So when you go to sleep, that's when your body starts to settle it in the organs. And that's when you need to hit it with something to stop it from doing that. That's when you hit it with aspirin. That's when you hit it with a statin at night.
And the aspirin at night
At
is
bedtime.
better than even during the midday or what?
Yes, ma'am.
Okay, thanks.
That's when it will be most effective. Nighttime. You know what statin? You know what a baby aspirin does? What does it do? Yeah, it acts like grease in the blood vessel. So that cholesterol that's trying to stick is trying to settle now. Now it's not. It's hit the. You hit it with aspirin. It can't stick at that time. You know, you take it in the daytime when they're sticking at nighttime. It's kind of like, yeah. Yes.
If your cholesterol is severe high and you want an aspirin, does taking it during the morning and taking it during the night, is it too much?
So, any baby aspirin you take,
Yeah.
I'll tell you the technical term and then I'll tell you in layman's language. Any aspirin you take, any non-steroidal anti-inflammatory, ibuprofen, Motrin, Aleve, Advil, all of those ones except for Tylenol. Tylenol is not a non-steroidal anti-inflammatory, but any of those will inhibit platelet aggregation and platelet activation. Means platelets are things that help you to form clots. And if you are not activating them and they are not bundling together to form the clot, that's what aspirin does.
Yeah.
So you increase your risk of getting bleeds, like stomach bleeds.
But this person is a stroke patient. They are on aspirin and a statin. So I'm just wondering if they are inactive, so to speak, but the risk of a stroke is really at the top, the
Oh,
threshold.
yeah. Yeah.
So I'm asking if give it to them in the morning and give it to them at night. I decided to change it to the nighttime, just in case.
You're giving them 2 at nighttime.
No, I gave them one. I gave them one aspirin and one statin, rovastatin,
Yeah.
at night.
Yeah.
What I'm saying is if it's suppose I give it to them in the morning, say accidentally in the morning and give it tonight, it's
That's not going to change things if you just do it once or twice here and there.
okay.
Yes, sir.
They said cayenne pepper, right? Is even better than taking aspirin. It will, clear a blood clot, quicker.
I
Is
don't
that
know.
true?
I don't know about that. I don't know. I have not seen it in the literature.
No. just
I've not seen
asking.
it in the
That's what
literature.
I heard.
I don't. It's not in the current literature. I'll tell you that. Yes, ma'am. Then we'll go to number 9.
So I had a question. Because we're Seventh-day Adventists, we understand the health message. What is the natural way that we can prevent like cholesterol instead of using aspirin? Because there are certain things that I would do as far as like your medical profession, like say for lowering blood pressure, maybe I'll take a pill or something. But I don't think like in every instance I need to take a pill. Is there like a natural thing that I need to do instead of taking pills like aspirin? You know, is there another alternative?
Where's Jamie? So, Jamie, the young boy that was there. James. Where's James? James, what did you tell me we need to do every day? Thank you. Okay. All right. I'm going to save questions until the end. All right. Number 9. We've talked about that already. atherosclerotic cardiovascular disease. Athero is blood vessels. Sclerotic, it means blocked up. Heart artery blockage. How do we prevent it? Okay. So, non-pharmacological, non-medical, non-medicine interventions are recommended for all adults with high blood pressure, and for those requiring medication, we want to get your blood pressure below 130/80. If your blood pressure is usually above 130 on the systolic, which is the upper number, or if it's usually above 80, which is the diastolic on the bottom number, either one being usually elevated, you take it once a day for 2 weeks, which is the standard at home check. You take it once a day at home for 2 weeks. I look at it and I see, well, hang on a minute, you have 85, 85, 87, 86, 80. You have high blood pressure, even though that other one is 120. Or if I see 133, 135, 137, 138, 136, then there's a 120, then there's a 135, then there's a 140, you're usually high. You have high blood pressure. You need to get it below that. At one meeting that I had attended a couple years ago in Palm Coast, Florida, there was a man from Duke University that was on the Joint National Committee for Hypertension. He made the rule. He was on the committee that makes the rules. So I said, well, what if I stay at like 141? He says that was when the recommendations were 140. Now they've lowered it to 130. So he said, well, your risk is at least 16% increased if you're even that 1 point above, usually. So if you see people with an average of 132, 133, and they think they're pretty good, but yeah, you're pretty good, but you still have a 16% increased risk of heart attack. Lower it if you can tolerate it. Because if you're falling down and passing out, that's a risk. Maybe you just need to keep it higher, because you can die instantly from falling down and cracking your head on things, right? So if you can tolerate being below 130/80, usually that's where you should be. Please. And a good way to get there is, James? Thank you. And diet, okay? And Brother Charles talked to us a lot about diet the other day. So if you were here and you listened, what he said. Okay? Because he talked a lot about diet. Okay? So it's what he said. That's the Adventist message, is the actual message that they're talking about. In fact, they mentioned Adventists. He said that they mentioned Adventists in their studies. Just do what the Adventists are doing, or what Adventists say they're doing. Okay? What Adventists believe in is what everyone should be doing. Okay? So we have an advantage. We already know those things. I can skip by that and go to the next thing, right? Okay. Prevention efforts. You got your calculator? Let's hit it. All right. ASCVD risk calculator. If you have them, pull them out. Mr. Minton, can you type in Google ASCVD risk calculator and bring it up, and I'll show you how to use it. Can you get on the internet? You can't get it on the internet? What happens? Okay, so we'll wait for him. While he's doing that, you have your phones open. Let's put in some hypothetical numbers. Okay? Let's say we're talking about a 50-year-old African-American male. So you're going to see there that there's a spot for age. So put in 50 years old. This one right there, ASCVD risk calculator. So put in 50 years old for the age, put in male for the gender, put in African American for the race. And when you finish that, we'll go to the next line, which is blood pressure. Everybody put that in? 50-year-old African American male. Okay. This African American male's blood pressure at 50 years old is an average when he came into the office today, and he's checked it for 2 weeks, and he's run an average because he has a Excel spreadsheet. He ran his average. His average blood pressure is 145 over 79. 145 over 79. So you'll see a systolic, that's the 145. You'll see diastolic, that's where you put in the 79. So systolic, 145, diastolic, 79. Then you're going to see 3 boxes, and this is where you get that information from your doctor. Doc, listen, you did a lipid test on me last year. I need those numbers, man. I want to calculate my risk of dying of a heart attack. And why on earth didn't you tell me about this calculate? No, don't tell him that. But you get that ASCVD risk calculator. Yes. So if you open this up on your computer, you're going to look for the one that says mobile apps. That one. That one that says mobile apps. The third one down, third one down, third one, right there, right there, right there. It will say mobile apps, yes. And then you will have this screen. So Mr. Minton, if you can put in current age 50, and yeah, 50, right there. Yep. Click male. Yep. Click African American. Yep. Systolic blood pressure, which is the top number, 145. Diastolic blood pressure, 79. Total cholesterol. This is the number that we used to say, if your total cholesterol is below 200, you're good. Not so. You need to know everything about you. So, total cholesterol, let's say the total cholesterol is 202. And the HDL, is it a bad cholesterol or good cholesterol? So HDL stands for high density lipoprotein, so the high should be high. In women, it should be above 50. In guys, it should be above 40. So this is a guy. Let's say he's not doing so well. His HDL is 38. Good cholesterol is low. Should be at least 40. LDL, let's say his LDL is 165. LDL is a bad cholesterol. So let's say 165. Good. Then let's go down here. Has this guy ever had diabetes? No, he doesn't have diabetes. Because if he had diabetes, oh, wait a minute. This is too high. Let's make this 140. Let's make LDL 140. Okay. Let's say he's never smoked. Let's say he's never smoked. Okay, is he on blood pressure medication right now? Let's say no. He's not on any blood pressure medication. Let's say, is he on a statin? Let's say no. Is he on a baby aspirin? Let's say no. Okay, looking at these numbers, let's go back so we see all the numbers. Go back so we see all the, yep, right there. Okay. In the old thinking, we used to say, oh, your cholesterol is above 200. So therefore, you need medication. Not so today. Let's look right here. Well, no. Let's look at this number. Can you see this 10-year risk? 7.2. As doctors, you know what we're trying to get that number to be? Below 10. So this guy is at 7.2%. So he has a 7.2% risk of having a heart attack in the next 10 years. Not too bad, because that means he has a 92.8% risk of not having a heart attack. So not so bad. For this guy, I would say, what would I say? What do you think I would say? James, what would I tell this guy to do? Thank you. Because his risk is borderline. It's not so high, right? It's within striking range. Because his best that he could be would be what? 3.9%. So he's actually almost double the risk he could be if he would just do something extra like. James, what does he need to do? Thank you. Okay, I could give him medication, but all he really needs to do is exercise. If I ask this guy, how often do you exercise? He's going to tell me, Doc, I come home late he's going to give me all kinds of excuses. And you know what I'm going to tell him? I don't want to hear your excuses. I get home later than you do, and I still exercise. So, yes, but I'll tell him if it's not that bad for you and you don't want to do anything about it, you're at a 92%. Is that good enough for you? Some docs say, Doc, that's good enough for me. I'll take it. And they walk out the door. If you want to do something about it, you have the data, and you can use it to maximize or minimize your risk. But you know what? There's even an extra bit of help here. You don't even need to think about this. You don't even need to, well, let me be careful. I was going to say you don't need to ask your doctor, right? But you can get an idea of what your doctor is going to tell you. Because I would look at this and tell you exactly what it says. So let's see what it says. And how do you do that? Scroll down to the bottom here and just click no. All right. And then it's going to tell you determine therapy impact. But if you don't want to do all that, you could have just clicked it right up there. You could have clicked it right from there. What's the impact of therapy? Means what do I need to do about this? Do I need to do anything about this? Click the therapy impact button right there. Okay, now let's digest this. If he quits smoking, will that make any difference? No, because this box, you're not able to check it. It means you're not even smoking anyway, so that has nothing to do with it. Look at this. This is an interesting one. Someone asked this question about a baby aspirin every day. If this guy took a baby aspirin, would that make any difference? It would make no difference. So that's why they don't even have a suggestion here for you to take a baby aspirin. Even though his cholesterol in the old days would have been high, right? But the American College of Cardiology says you taking a baby aspirin won't make any difference, but you increase your risk of having a stomach bleed, which is an emergency. Okay? And they tell you you should intensify the statin. If I click this box and see what happens. If I start a statin, if I start a statin, statins have risks. I never told you that. You have a risk, and the biggest risk, 20% of people have it, severe pains in the muscles or joints. Severe, to the point where most people already stop the statin before they come back and see me. Because they say, whoa, Okay, so there's a risk of taking a statin. So if this guy took a statin, it would reduce his risk to what? 5.4%. So like 1.8% reduction in risk. Is it worth it to get severe muscle cramps? I don't know. Some people say yes, doc. Some people say, I don't know. I don't want to do that. I'll take my chances. Or I tell them, why don't you, James? What do they need to do? Thank you. Then you don't have to worry about muscle cramps unless you're dehydrated, so drink if you're doing that. And then you don't need to take a statin. This guy, I wouldn't give him a statin. I would ask him to exercise regularly and see me back in, how long does it take to change these numbers? 1 month. If you do that consistently for 1 month, these numbers change. So I tell him to do that for 30 minutes a day, 5 days a week. We'll recheck your numbers in 1 month. And when he comes back, if he's done it, those numbers have gone down. Guaranteed. If he's done it. Okay. And then he tells me, I look at him and I'll say, so, James, you walked, your numbers came down, you're at 5.7. You want to do anything else? James tells me, Doc, thank you very much, but I'm good. I'll keep on walking. All right? That's what most people tell me. So, I want you to, but there are other things you can do. I'll show you real quick at the end. Let's take this off, because his blood pressure is a little bit high, right? 145 over 79. What if he took a blood pressure medication? His risk goes down to 5.3%. But each blood pressure medication has side effects. A lot of them, for example, the easiest one, amlodipine. But amlodipine will give you a risk of swelling, leg redness, or a rash on your leg, somewhere between the knees and your ankles. That's the easiest one. The other ones are worse risks. The other ones play around with potassium. Potassium is not good to play around with. Why? You get arrhythmias, and arrhythmias are life-threatening. What do they put inside the lethal injection to kill people? Potassium chloride. Big dose. Stops the heart. End of story. So don't play around with potassium. Your heart doesn't like potassium to be low. Your heart doesn't like potassium to be high. But your body regulates it if you just eat food. I wouldn't give potassium unless I know exactly where your potassium is at. Because you cause more problems if you do. Yes. Your body will regulate that and it'll be great. For some people, I tell them that. When people come to my clinic, except when the Department of Corrections tells me otherwise, because sometimes they tell me, you got to do this and you got to do that, and then I do it. Well, that's a whole other story. They're the boss, okay? I'm the visitor in the prison, to be honest with you. The doc is the visitor. The security is the staff. They live there. I come and go, okay? So I'm the visitor. And when the Department of Corrections says you jump, I say. So when they allow, and plus, do prisoners get a choice of the delicious foods they can eat? They don't have any choice, so why am I telling them about diet anyway? But they do have a yard that they can walk around in, and some of them walk around in the yard when I tell them to walk around in the yard. And then their cholesterol goes down. So don't mess around with potassium. So the other medications, they'll move your potassium up, they'll move your potassium down, they'll speed up your heart, they'll slow down. They have side effects. So the easiest thing is, James, thank you. All right. All right. So now let's take this off and let's go to the advice up there in the corner. What advice would the doctor give me if I went to him? Okay, what should I do about my cholesterol that's too low? Click it, and it'll tell you the advice. Click this. Yep. Okay. So it says, probably don't need a statin. But you can talk to your doctor about it. Because if your doctor is too busy, he might just say, yep, statin, because it'll make your cholesterol go down. But yeah, it will go down by 1%. Why would I want to take a risk for 1% change? No, I don't want to take that risk. Okay, so by using this before you go into the doc, or while you're with the doc, if that kind of doc has time, and if they don't have time, you got to wonder, what? Anyway, so if they don't have time for you, then why are you going there? So anyway, you can use this and look at your numbers. You know, some of us get these apps on our phone where you can see your labs like a day after you do them. Do some of you have that? Use that and use your blood pressure. You know, ask your doc, what was my blood pressure? What was my cholesterol? Because after that, you know all the rest of the things. If you got that information, you use this calculator, and then you look through all these pieces of advice, and you remember the Adventist health message. All those things that say medication, you can walk. You can follow Mr. Charles's advice about food. Ellen G. White's information about food. Get the book Counsels on Diets and Foods. Or just listen to everything we're talking about in church. We already know it. Okay. If we can go back to my talk, I'll wrap it up right now. Yes. Yes. Is this an exercise? It is. You might have to do 45 minutes of that compared to brisk walking, but you can still do this. Okay? Yeah. So my undergraduate degree is in gerontology, which is the study of aging process. When I first got out of college, I worked in a place where all I saw were seniors, only seniors, and I wasn't a doctor at that time. So what I did was I started an exercise class called Tai Chi. Tai Chi is just slow, easy-looking movements, right? But as I'm teaching them and doing the movements, I found that my own body became like more limber and more relaxed. I could jump higher in basketball. I mean, it was incredible. So take a look at some Tai Chi exercises. Those you can do even if you can't walk, and those are also beneficial. Remember the time and try and do them briskly. Okay? All right, so this is mine. Okay. All right. Okay. It's not working anymore. Yes, please. Oh, try to move it. Okay. Anyway, what I want to say is if you exercise, your blood pressure will go down. And there's a slide that I have, if I'm able to show it, it tells you how much exercise will make your blood pressure go down by how much. It tells you by walking how much will your blood pressure go down. It tells you about those different things. So I wanted to show you that slide so you get an idea of doing things makes a big difference. But if I can't see that right now, I'll take a couple questions while he's looking at that, if there are any other questions left. Yes, sir.
For the exercise, benefits of walking, what time of the day is the best time?
Well. We are in Florida, so it depends on where you are. So I'll talk about Florida. In Florida, the best time of day I would say to walk, it also depends on your medical conditions, okay? You want to walk, excluding all those, I would walk between sunrise and 11 a.m. Why? Vitamin D. You get vitamin D from early morning sunshine or late evening sunshine? Early morning sunshine is where you get the best vitamin D. But why else do I say early morning in Florida? Who said that? Yes. Have you noticed that if you get up around 7, it's cool. Most days, even when it's 90 degrees in the daytime, it's like 70 in the morning. So if you walk at sunrise, you get that early morning sunshine. It's cooler, less traffic as well. You're less likely to get hit and killed here because if you see people driving here. And yes, so the humidity, you get the early morning sunshine. Treadmill is just as good. And actually, treadmill is, except the treadmill, you got to watch out. You don't want to miss that step and bang your face and things like that. But, because I've even almost done that sometimes. But treadmill is just as good, and you can even tell how far you're going, how many calories you're burning, all that kind of stuff. So treadmill is just as good, yeah. But you're not getting fresh air, you're not getting sunshine. But as far as health benefits of exercise, you're getting it on the treadmill. Yep, treadmill is good. Okay. So, I can move this thing again. Oh, excellent. Okay. 5 minutes and then we'll be done. If nobody has any other questions, let's see. There we go. Forget about all this jibber jabber because I kind of said it in a nutshell. Oh, here's another one. I want to talk to you about this. Have you ever heard about a calcium score? Has your doctor ever talked to you about a CT calcium score? Insurances pay for it. And I'll tell you when and why. Because then all you have to do is say a few key words and you open it up. And here are the key words. Doc tells you your cholesterol is high, Mr. Anuligo. I know, doc, but I don't know about these statins. I don't know about muscle pains. I'm an active guy. I don't want to be on that. Do I really need to be on it? I don't want to be on it unless I really need to be on it. Well, look. Your risk of having a heart attack in the next 10 years is 7.2%. Yeah, doc, numbers. I want to know what's going on inside me before I put something in my body. You sure my arteries are clogged? I don't believe my arteries are clogged. Who cares about that number? And the doc says, well, I'll tell you what. In a patient that is hesitant to start a statin, CT calcium score is recommended so that will help the doctor convince you to take a statin. And I'll show you how that works. Patient comes into me, I said, okay, you got 11% chance of having a heart attack in the next 10 years. Guy says, oh, I don't want to take a statin. I tell him, okay, you know what? We can do a CT calcium score. If I do a CT calcium score, which means you just sit there, they do a CT of your body, that will show you if the arteries are blocked and how blocked. Mild, moderate, severe. I did that on some people, and that number is 2,000. You're supposed to start a statin if it goes above 100. When it's 2,000, I look at them and say, now what? They say, start it, please. You know, if it's above 100, most people start it. But if it's, sometimes I do that, and the person I'm trying to convince, guess what the score is? 0. And they look at me and say, doc. And I say, yeah, you don't need a statin. You're good. Keep on doing what you're doing. Okay, so if you're thinking about a statin, you're bordering on a statin, you just can't really make up your mind about being on a statin, CT calcium score, except no substitutes. Insurances pay for it. Usually. Don't come back to me saying I got a bill for $1,000, okay? Check with your insurance first and see if they pay for it. Okay, so let's move on. Earlier on, I told you not to eat trans fats. Aren't you wondering what on earth are those? Okay, James. Yes. Candy is a trans. Did that guy go to medical school? How does he know this stuff? Okay. James, tell me another unhealthy food. Yeah.
Jolly Ranchers.
That's a candy. Besides candies, any other food that's unhealthy? Yes, miss.
Potato chips.
Yes. What else? Miss. Juices. Why? Yes. Okay, I'll give you a secret. I'll give you a secret that gross. James. Yes. So you know what James and, what's your name?
Zalika.
James and Zalika are absolutely right, but I'll give it to you in a nutshell. Processed foods or fried foods. Now let me show you a trick the grocery stores use. Where are all the processed foods? At the cash register and in the middle. So if you walk down the aisle, you're going to hit what? Processed foods. They put the natural foods where? In the back and on the sides. So you're not going to hit those straight away. You got to make an effort to turn and actually go to them. Okay? But if you just walk in straight and you need to get something to eat, you're going to get what? Processed foods. That's what you stay away from. That's what causes heart attacks. And guess what is more in the stores? You see more processed foods or more natural foods? The processed foods are more. So why are we getting heart attacks here in America? Because we love processed foods. Twinkies taste good, don't they? And Christmas is coming up. All that good stuff for Christmas is all what? Processed foods. I'm not telling you not to enjoy your Christmas, but after that, leave that stuff alone as much as you can. Okay? Because there's also quality of life. Okay? If you're eating celery every day, what's the quality, right? You'd be like a rabbit. Okay. So a little bit of trans fat with moderation. As Adventists, we know that. Okay? So processed foods, fried foods, sugary foods, these are bad. And I think I put some examples. Where did they go? Yeah, processed foods, fried foods, and even some natural things have a lot of trans fats. Beef, lamb, milk, cheese, and yogurt. Wait a minute, we eat those things. They have a lot of trans fats. They can give us heart attacks. Be careful with those. There is almond milk. I read Ellen G. White's writings today. She says almonds are actually better for you than peanuts. Peanuts give you some different things. Almonds are better. So they have almond milk nowadays. Okay? Consider those. All right. I wanted to show. Oh, that's the. This is going to be where I end. The 30 minutes of exercise that you should do should fit into moderate or vigorous. Vigorous, although you can get injuries from. Remember, accidents is the third leading cause of death? So let's try for moderate. So those things in moderate, brisk walking, biking, and biking at 5 to 9 miles an hour is not that fast. It's just a regular bike ride. Do that for half an hour, okay? Ballroom dancing, active yoga, or recreational swimming. So if you have a swimming pool or you are able to go to the Y or have a friend, do it. But the easiest of them all is, 30 minutes. Okay? All right. That's where I'm going to end. Thank you so much for listening, huh? Stationary bike will work just as well. Be careful with those, though. I had a patient that fractured his coccyx on it, because it went up and down, and he went up and down with it and banged his coccyx and had bad coccyx pain. So be careful of those. All right. So the things I want you to remember are, James?
He's gone. Walking.
Walking. Number 2, diet. What about diet? Minimize the amount of processed foods that you eat, especially sugar, because sugar will lead you to having heart attacks, strokes, and things like that. But you can eat fructose, which is in fruit, vegetables, and like that. And then the last, what should your blood pressure be? Below 130/80. And how can I tell if my cholesterol is where it needs to be? What? Wait. What did we just do? This whole thing I asked you to put down? The ASCVD risk calculator. You have it at your fingertips, don't you? Like literally. At your fingertips. Okay? Just find out your blood pressure. Just find out your cholesterol numbers, total cholesterol, HDL, LDL. They're on every single, and if your doctor says he's doing your cholesterol, those numbers are there. Okay? Get that done yearly. See what those numbers are and adjust yearly as needed, at least yearly, right? If they're way off, adjust even more often, okay? And that's it. The last thing that I just want to just briefly mention for 2 seconds is A1C, because I see that some people are going to get A1C checks tomorrow. Maybe not. Okay. So you're going to get your cholesterol. Some people are going to get cholesterol checks here. Then they can use the ASCVD calculator. Some people are going to get blood pressure checks. Once you have those 2 numbers, if you get it tomorrow, put your numbers in the calculator. A1C tells you if your blood sugar is too high. You want that number to be below 5.7 if you're not diabetic. If you're diabetic, you want it to be below 7. Okay? That's it. Thank you, brothers and sisters, and I hope you have a happy Sabbath. Thank you for listening.
That was interesting, eh? Thank you so much, Doc. We appreciate you. And you have really made us smarter. Yes.
Good afternoon, everyone. And I must say thank you to Doc. Some of these things is not that we didn't know it, but we weren't paying attention. So now that he has awakened us and remind us, I hope by God's grace that we will listen and follow. Before we I want to especially thank all those who have done their part this afternoon with Sister Calhoun. But I especially want to thank Brother Edope, who is our Elder of the Week, for the reading that he did. 3 John 2. 3 John 2. And I'm going to read it again for emphasis. He said, "Beloved, I pray that you may prosper in all things and be in health, just as your soul prospers." And I was listening to the whole time. And in summarizing and thanking him, I have to say, I have to read this one little thing right under the ASB thing that you asked us to do. I did mine. I'm not saying anything. I'm not going to say it. It says, the most important way to prevent ASCVD is to promote a healthy lifestyle throughout life. And everything he was mentioning is right there. Your vital force, right? Preserve your vital force. And I like that word. I like that. I'm here. I don't know if I've heard about it before, but you know, we probably heard about it in some small ways. But you know what? Preserve our vital force. So how do we start doing that? All the things that he was mentioning, right? And so, wellness, he mentioned, is about keeping your entire body in optimum health. What does the Bible say? The Bible says he wants your soul to prosper. He wants you to be in health, and he wants you to prosper, you overall, but your soul should also prosper. So, there was another question I have. I seem to have lost it. I hope I didn't lose it. Anyway, I don't. I seem to have lost it. Another question I had. Yes. I was looking at the commentary here, and it says that physically weak, but spiritually strong. If you're physically weak and spiritually strong, how good is that? Is there a good there? Is there a balance there? Huh? No, I don't see a balance. So it don't make sense. You're doing wonderful. It is good to be spiritually strong, but you're so weak. You can't walk, you can't spread, you can't talk, you can't tell anybody about Christ. Well, these days you can sit down and spread the word by using your technology and all that, right? So Doc, with all that you have said here tonight, everything is backed up by the Bible. And right here it says, "Beloved, I pray that you prosper in all things, be in good health, just as your soul prosper." Now, thank you so much for your presentation, and we will pay attention. I don't know if you want to come back and say something before we close out, because we want to close with this song, 294. There is power in the blood. Power in the blood. And then we're going to ask Elder to close off in prayer.